I thank the gentleman for yielding me time. Mr. Speaker, I rise today in strong opposition to the rule and the underlying legislation. Here we go again. This bill marks yet another attempt by the Republican majority to repeal the Affordable Care Act, but the first time after implementation of many of the provisions that Americans have relied upon. People think the ACA only provides the ability to buy health insurance on an exchange or marketplace. Yes, it is a new way to shop for health insurance, in which you can compare plans apples to apples. Yes, it is a way to obtain subsidies to make their coverage more affordable. Yes, with all these benefits, people can join the system and cover themselves prior to a medical catastrophe. However, the Affordable Care Act has also accomplished so much more than that. Repealing the law, lock, stock, and barrel, that has been in place for nearly 5 years is not in anyone's best interest. As an example, the ACA created the Prevention and Public Health Fund, an unprecedented mandatory investment in states' public health systems. The need for this investment has become increasingly evident after public health emergencies in recent months. Evidence Ebola. Today we have measles. Repealing the ACA today would mean 129 million Americans could again be denied insurance coverage for pre-existing conditions. It would mean Americans would no longer have access to free preventive services such as vaccines, disease screenings, well child visits, and tobacco cessation. I heard from one of my constituents, Laura, who as a freelance film producer with a former cancer diagnosis found getting health insurance to be impossible. Thanks to the ACA, she now has coverage and is able to have regular checkups to make sure that the cancer does not return. Do you want to take away all of that? The health care providers, health plans, and consumer advocates in my district and across the country have worked hard to put these provisions in place.
I yield an additional 30 seconds to the gentlelady.
Thank you, Mr.
Gentlelady's recognized.
To put these provisions in place and to make the ACA work. We can't take this away now. It works. I urge my colleagues to vote down the rule and the underlying legislation, and I yield back the balance of my time.